Hey everyone, thanks for tuning in. This episode is brought to you by my course, Rest Assured. If you've been struggling with falling asleep, or staying asleep, or just not waking up feeling well rested, you've come to the right place. Cognitive behavioral therapy for insomnia, or CBTI, is the gold standard intervention in the management of insomnia. Rest Assured is a digital course that walks you through CBTI, step by step, with everything you need to succeed. Each of the 6 weekly modules guides you through some important background information for the different techniques, explores the evidence-based techniques in detail, provides multiple examples of exercises so you can find the one that works for you, and reviews the work you've completed since the last module. And Rest Assured is just not another DIY left to your own devices, but rather, you get direct access to me, a board-certified sleep physician, in twice monthly office hours, where you can ask me face-to-face any questions you may have about the course material. So check out www.wellrestedmd.com/RA to learn more. That's wellrestedmd.com/RA, or just head to the homepage and click on courses to learn more. Enjoy the episode. Hey there, friends and neighbors. You're listening to the Well Rested Podcast, episode number 63, Coaching. I'm your host, Dr. Joshua Lennon. Do you ever have trouble following through with a goal, whether New Year's resolution or medical advice? In this week's episode, I sit down with Danielle Avery, a certified health coach, to discuss how to bridge the gap between what we know we should do and actually completing it. Danielle also holds a doctorate as a nurse practitioner, currently practicing sleep medicine. All right, so I'm pleased to be joined by Danielle. Danielle, welcome to the podcast.
Thank you so much for having me, Dr. Lynn. I'm so honored to be here today.
So, I really wanted you on the show because you are a coach. You are a health and wellness coach. Can you kind of walk our listeners through what that actually means? What does it take to become a coach? What kind of training is there, and what makes somebody a good coach?
Sure, that's an excellent question. So let me kind of just first start by saying health coaching is such a young. It's still such a young field of intervention. It has been around for about 20 years old. So with it being so young, only about 20 years when it first started, of course, regulations and things like that, there still needs to be more things on that end. But it started about 20 years ago. And right now, there are a number of different ways you can be certified as a health coach. And there's really, honestly, right now, no regulation that necessarily says that, hey, you have to be certified. I chose to be certified through the National Society of Health Coaches. And this is actually a society where you actually have to have a license, or you have to be a licensed practical specialist. So whether that be a physician, a nurse practitioner, a massage therapist, you have to have a licensure and keep it up. And so I wanted to be regulated.
So if an individual wanted to work with a coach, is this something that they should ask them about to say, not just are you certified, but through what organization are you certified, or what sort of gives you the credentials to become a health and wellness coach?
Most definitely. Take for instance, if someone was seeking out a personal trainer, you definitely want someone who's certified, because you can easily go to whether that board or that website and say, okay, what is the curriculum? What is the modalities that they use within this certain certification or, this program. So definitely you want a certified coach. With many fields, there can be people, their intention in doing it. Do you just want the title, or do you want to put the effort in behind it? And so seeking out that certification kind of really not only qualifies you, but then it also, I think, puts the seriousness behind this field that's still growing.
So there's all sorts of different coaches out there, for entrepreneurs with business coaching and life coaches. What sort of separates a health and wellness coach from these other types of coaches?
Sure. So in this wonderful field of medicine that we have, the health, the health and fitness field, and then also the medical field. Now, you really have to have a combination of the two, because there are so many different, chronic diseases that we're dealing with now that, compared to 50 years ago, 100 years ago, we weren't necessarily seeing or dealing with to the extent that we are now. And so the provider simply can't. Can they do it all? Probably, but it will take a lot of effort, a lot of time. And so the beauty about health coaching now is that, you have this specialist who can come on board and partner with the provider, or sometimes patients will seek out the health coach, or clients will seek out the health coach to come on board and actually help walk this journey with them and improve their health.
So, I work in the world of sleep, obviously. Is there any part of the curriculum to become a health and wellness coach involving sleep, or is that something that's emphasized at all during training?
That's a really good question. And now I can speak for my particular training. There was not necessarily a certain module that emphasized, solely on sleep, but, they touch on a number of things like behavior change. And so it not necessarily specified specifically on sleep, but there are those, if you will, there are those interventions that can help with sleep and things like that is kind of embedded within the program.
Now, what sort of client seeks out the help of a health and wellness coach? And is there an ideal client out there for coaches to find?
That's a really great question. I don't think necessarily that there's an ideal client, because I think honestly, to some extent, depending on the person, and we all can benefit from some type of coach, in some way, specifically for health and wellness. Someone may be doing very well as far as, okay, I get up and I exercise every day. I eat healthy. I'm going to sleep, but the stress management may be out of whack. Or, some may, coming outside of just your health and wellness coach, you mentioned business coach, and someone can be doing excellent with their health. And then, the business ventures are, out of whack. So I think that depending on the need, there are many different types of coaches. Specifically for the health and wellness coach, they work well with people who are just kind of needing a little bit more. I hate to use the phrase handhold, and I don't want to use that because it's negative, but someone really to come and partner on side of them. I think that'll be a better illustration of the relationship, someone who's seeking that partnership.
So you had mentioned, over the last several decades, the increase in these diseases of modernity. Whereas, 100 years ago, many people, when they passed away, it was from infection or accidents or things like that. And now we find ourselves with epidemics of heart disease and obesity and, all these problems basically resulting from our lifestyles. And this is frustrating for a lot of healthcare providers because there can be a pretty wide gap between the medical advice that we give for some condition and the actual health behavior of the patient on the other end of that exchange. For instance, if someone comes in with a glucose, a blood sugar of 400, which is really high, and we recommend a certain dose of insulin or a diet or something like that, chances are the individual is not necessarily going to follow that advice and then end up suffering the consequences, which is extremely frustrating for all parties. And we know that if somebody has high blood pressure and we recommend changes in their diet or a blood pressure medication to reduce the risk of cardiovascular disease, that would save a lot of morbidity for that individual. And yet that's only followed about half of the time. And this is one of the main contributors to the largest source of death and disease in the modern world from cardiovascular disease. So there's this very large frustration. Because we as providers have a pretty decent sense of what the problem is and how to fix it, but that fix isn't really being executed on the other end. That most health issues are not solved in an ICU. They're solved in the kitchen. They're solved in the gym. They're solved in my specialty in the bedroom. And so how do we bridge this gap between medical advice that we think is the right thing to do for somebody's health and actually getting somebody to follow through with that advice? Because overall, no matter what issue you look at, whether it's asthma care, blood pressure, or in our world of sleep, of following sleep advice and use of sleep equipment appropriately, it's generally only about 50%. It's only about half the people, half the time, are sort of following recommendations for better health. And the result that we have, of course, is poorer health outcomes, rising costs of care, more utilization of emergency services, rather than sort of routine preventative care. So how do we bridge that gap? What is your sense?
Sure. I think that's such a good point. And you're definitely right. Right now, if we were to give it a percentile, when a patient comes to see a provider, about 30 to statistics show about 30 to 60% of patients follow through with recommendations. A big part of that sometimes is the patient's understanding of actually what was said within the visit. We do understand in the healthcare field, there's a diversity of patients, there's a diversity of education levels. And so I think that there is some things that in the medical field that needs to change, but then there's some things within the patient's ability that needs to change also. How do we bridge that gap? For one thing, we have to start having more conversations. And for the provider, when they are seeing patients, time is so limited now. I can recall working at a clinic where you would see 3, 4 patients in an hour, and that's just honestly not the amount of time to give good quality care to a patient. But you can only imagine how many providers are doing that. And then we're seeing this resulting of this extensive and this ongoing chronic issues in the medical field. And so this is why, kind of bringing it back to the health coach perspective, it really takes a multidisciplinary team, because if the provider's not able to have all of those conversations, have a specialist come in behind that provider who can, go reiterate what was said and, ask, do they understand, and things of that nature. But then also it takes holding the patient accountable also. And again, that with a health coach, when we're talking specifically, that's again where that role as a health coach can come in and kind of walk alongside that patient, because sometimes patients simply need a little bit more accountability. If you don't mind me adding on, right now in the field that we work in, there are so many mixed messages. There's so many mixed messages. And so as a patient who may not necessarily know a lot of medical lingo, and they're coming into the provider's office or whatever, appointment, clinical appointment they're coming in possibly as a novice with all these medical terminologies. And so for us being able to have the conversations and then also putting them in the hands of someone who can have further conversations. So from the time that they are in office or in clinic to the time that they go home, there won't be that gap. And so again, kind of, rooting for the health coach. This is why, this type of specialty can be so vital and really is a great additional role within the healthcare role.
The most common way that most medical problems are managed is medically, with medication, pharmacologically. And a key team member some of the time can be the pharmacist. And there are some, absolutely fantastic pharmacists out there who really go out of their way to make sure that every single patient understands everything they possibly can about, those 30 billion pieces of paper with the tiniest text you've ever seen, so that they can understand their medication better. But that's not always the case. And to get to the point about, patients may not, understand the directions affected, which is, that's can be understood. But say for an infection, a UTI or something, and there's a prescription written for 7 days of an antibiotic to be taken twice a day. So this is sort of mentioned in the clinic visit. Is somebody goes over their head, they walk out of there with a prescription, they go to the pharmacy, and when they go to pick up the medication, I mean, how overly explicit do you need to be? Because it's written right on the bottle. Take one pill, at noon, or take one pill in the morning, take one pill at night for 7 days, and then the pharmacist or the pharmacy tech will tell them, take this twice a day until the bottle is empty. And yet we know, it is as simple and concrete and multi-formatted between written and orally as it can be, that a large number of people are not taking a simple 7-day course of antibiotics correctly. And this is one of the main contributors to antibiotic resistance that is plaguing us, as we speak. So perhaps engaging our pharmacy colleagues, to a great extent might make a difference. But where do you see in something like that, like a short course of medication, what kind of role, could a health coach play in that? To ensure that the instructions of the medical provider that are brought to the patient's attention to a greater extent by the pharmacists, how can a health coach ensure that there is no gap there in understanding between the medical team, the pharmacy team, and the individual themselves?
Good question. I think check-ins, one thing that I'm really proud of insurance. In some insurance carriers are offering so many different benefits to their patients. Cigna specifically actually has health coaches. And some of them have different nurses who kind of check in with the patients. And so health coaches are sometimes in the clinical setting, sometimes more on the insurance side, but sometimes just having that check in with the patient, Miss Y, received a prescription for microbid on Monday, checking in with them, have you taken how are you doing on your prescription? And of course, that takes a lot of effort, this whole insurance industry is a big machine. And so how much bigger do we have to make it in order to have patients comply? So with a health coach is kind of that checking in to see has the patient followed through with, what was recommended for them. And I think that's probably the best thing is just kind of that check-in with them.
So a lot of times in medicine, we view insurance companies as kind of the enemy. They're the ones standing between, our recommendations and patient care with denials and restrictions and, tiers of care and so on and so forth. But what you're saying is there must be an enormous financial advantage for an insurance company to employ, a whole suite of coaches to engage in patients in their care, because when patients follow through with medical advice, it saves money. When they don't, it costs the insurance company just a hell of a lot more money.
Sure, most definitely. And then it costs us more money, and premiums and things like that. And so
And as taxpayers with Medicaid.
yes, most definitely. And so that actually is a really good point, Dr. London, when you definitely take that in perspective. For an insurance carrier to go to this extent to make sure patients are being compliant, follow with recommendations, it definitely must be an explicit sign that this is definitely going to help save with, with the cost, the expense of things. So most definitely, that's a good point.
So to help bridge this gap between medical advice and health behaviors, we're seeing different players step into the game, and health insurances are really trying to save a dollar. But I applaud them for engaging in this. I think it's actually really important. But do you think, is there a role in not just health insurance, but even on the side of the provider or at the side of the pharmacy? Should we be having more behavioral specialists involved in medical care? Whether in the office, in the primary care office, or at the pharmacy to help ensure the patients are understanding and taking their medications correctly. And if so, what does that model look like? Is it sticking a PhD in the waiting room for, of every office, or is it, having, on speed dial a number of different, health and wellness coaches that can help engage with patient care?
That actually is a really great question, and I'm going to kind of answer it backwards. What does implementation actually looks like? And I think that can look like a number of things. That can be as simple as, well, not as simple, but it can be, the provider comes in and speaks with the patient, and then that health coach comes in after. It can be call in and check-ins. I know on our team, we have a young lady who actually reaches out to patients to check on them. And I think that, in the medical field now, sometimes we're so busy and we have our hands in so many different things. We're busy seeing patients that we don't necessarily have that time to check in with that patient after the visit. And so having that person who can actually reach out, it adds a personal touch. And I think patients feel cared for. So that can be having someone implemented into the clinical setting, or someone actually doing phone calls, especially for elderly patients who are at home a lot, especially since the pandemic. I think those call-in and check-ins are actually a really good thing. Let me back up and kind of answer the beginning part of that question. When you think about children, children need structure, right? They get up at a certain time, they have breakfast at a certain time, they go to school or whatever activities they have, they go to, they have this structured life. And we do that. We give children the structured life because we know that they do better with structure. But when we become adults, life happens, right? When we become professionals, we become husbands, wives, parents, and, life kind of gets out of balance. And so Yes, on the medical side, we can definitely do some things to help patient engage, follow through, things of that nature with their medical recommendations. But again, we do have to emphasize it. At some point, the patients have to step up, and because it's a team effort. And that's one point about the health coach. We allow the patient to set the goal. Sometimes we attempt to push the patient too far when they're just not ready. That, when you think about the trans-theoretical model, pre-contemplative, contemplative, all these different stages of change. What stage of change is this patient actually in? Because if you're trying to take them from pre-contemplating to action and they're not ready, it can frustrate you or the patient.
So can you elaborate on that a little bit for people that may not be familiar with this? You're saying that there a different approach to an individual depending on how willing they are or not to engage in some new behavior. So let's say, for instance, because this is something that we face a lot, where let's say in order to we want to synchronize somebody's circadian rhythm and improve their daytime alertness, and so we think that if they get up at 6:30 every single morning, that's going to be sort of the best time for them. And so you're saying our approach to help that individual get up at 6:30 is going to be tailored to what state of decision making this individual is in regards to whether or not they even want to change what time they wake up.
Most definitely, that's definitely what I'm saying.
So what are those different stages, and how would you adjust, with this example of getting up at a specific time, how would you approach this, depending on or based on these different stages of behavioral change?
Sure. I've used, actually, this is when I was in graduate school, this was probably one of my favorite models, was the stages of change, or the theoretical model. And I enjoy it so much. I used it a lot when I used to be a personal trainer, because again, depending on where someone is, are they just in that pre-contemplative stage, meaning have they just thought about it? Or are they actually in that contemplative state where they say, okay, I'm riding past the gym, I think I'm going to get a membership. And then they actually take action. Oh, okay, I'm going to get the gym membership. Now maybe I'm walking or I'm exercising at the gym 2 days a week, 3 days a week, 30 minutes. And then that maintenance phase is going to come after that 6 months, that a patient has been in that action phase where they're consistently keeping up that behavior. But again, that's why it's so important for us to understand which stage of change is this patient actually in. Because again, if we're trying to take them too fast, too soon, if are unwilling, that's when patients can show resistance. But then also, one thing as a health coach we're trained to do, what is causing the patient to be ambivalent about making the change, right? And so it's having that conversation and understanding, where is this patient at and how can I push them to the next stage of change?
Right, because my first instinct whenever somebody is pre-contemplative is irritation. I'm frustrated. What? Why is it such a big deal? Like, get up at 6 or just make it happen. And
Exactly.
I feel myself being pulled much more towards anger
Yeah.
at their pre-contemplative stage, without and it takes some concentration and reminding myself that maybe they're just not ready yet. And
Sure.
but that's it's a difficult place to come to, I think.
Sure. You're definitely right about that, Dr. I think over the years, thank God, I've humbled myself a lot. But I was that personal trainer who wanted you to throw up on the recumbent bike, where I'm pushing you to go, 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 go. And I've just learned over the years that we're all at different stages, because for someone who's showing resistance to change, it may not necessarily be resistance. Sometimes there's psychological issues. Sometimes there's financial issues. People will make a plethora of excuses. And so that's why, again, we have to actively listen to the patient. And that takes time to do this. And again, that's why it takes a multidisciplinary approach. Sometimes as providers, we don't necessarily, in one visit, we may just be able to address one complaint, because it took that whole, period in order to address that one complaint. So I can definitely understand the frustration that the provider can experience, especially someone as calm as you are, Dr. Linda, for you to
I'm raging on
get
the inside.
frustrated.
So let's say, just expanding on this example of somebody that we're trying to have a little bit more circadian regularity, and we assess that they are pre-contemplative. How do we force them to do what we want them to? How do, what are the strategies, the core strategies used in health coaching to help transition this individual from this pre-contemplative stage all the way through action and maintenance?
Yeah, great question. We enjoy motivational interviewing and health coaching, and actually allowing the patient to hear what they're saying. For someone who's saying, I want a better sleep pattern, but I don't want to go to bed earlier, and being able to hear, really what are they saying? So what I hear you saying is that you want to sleep better, but you're not necessarily willing to go to bed early. Okay, what are you willing to do? And so that's how we kind of assess, where are they now and how far can I push them? Or maybe this visit is just about, hey, I'm just seeing where the patient is right now, and I may not be able to move that patient for 2 weeks. And that's why health coaching is not necessarily done in one visit, it's multiple visits. Again, it's this journey, walking it out with the patient, because there's a degree of accountability. I think there's a degree of listening, but then there comes a time to a degree of accountability that we have to give a push, because what's the point of it all if we're never getting anywhere? And so motivational interviewing and really listen to the patient and allowing them to hear what they're saying is vital.
Sounds like a lot of compromise.
Most definitely. As a provider, I was trained to, what the provider says, the patient follows through. On the health coaching side is more of the patient making the goals, setting the goals, and then the health coach coming on alongside to walk with the patient towards that goal. The health coach does not necessarily set the goal. We can help push towards the next goal, but it really is about partnership with the patient or the client, not necessarily about setting all the goals for them.
Seems like a much more respectful approach than sort of the paternalistic model of medicine, where doctor is king and whatever I say goes. I think this feels, if I was a patient, I'd much rather have my wants and needs known and respected than just being kind of bulldozed over, with by a bully who's just yelling at me to wake up at 6:30 every morning.
That one thing that is one of the most beautiful things I enjoy seeing is patients kind of, they kind of come in expecting a certain type of visitor and experience. And when you sit and you actually listen to them and allow them to talk, sometimes that's so satisfying for the patient and something that they have not experienced. And sometimes, just that engagement or just that them allowing them to kind of talk and for them to tell their story. It's amazing what patients will tell you. And that that creates a rapport where you may not get much out of them, within that first visit, but over time, it's amazing what people will open up and possibly what they're willing to do and push themselves to do. And then they're taken apart in their own change. It's not necessarily someone just pushing you all the way along. These are goals that you wanted to set. And so I'm just helping you move along with them.
It seems like there's a tension here, because this requires a lot of patience, especially it's one thing if somebody's ready to change or in the midst of change, but for somebody who is not yet contemplating change, all this rapport building and mutual respect building, this takes a lot of time to build that relationship, and not everyone has the patience for that. A lot of individuals, and we see this day in and day out, they come in with a problem that's been going on, often for decades, and they want it fixed, like right now, right away. Like, what can you do to fix this tonight so I never have to think about it or worry about it again? And, what you're talking about is something that may take weeks, if not months, of slowly inching the way towards a compromise, which, neither party would have been all that happy about, at the very beginning. How does one navigate that to in such a way to keep both parties engaged? Because it would be quite easy, from the patient perspective to say, well, I came in here, I wanted this thing fixed right away, and it seems like every week, we're getting nowhere, except, now I'm in, deeper touch with my feelings. Uh, so how do you keep them engaged? How do you keep them coming back?
Sure, that's such a good question. One of the things, Dr. Lennon, I am a big believer in lifestyle change, not trending. And I think that we have had years and years of trends, this diet and this exercise and we have all of these trends. And over here in the Western world, we have such a significant emphasis on nutrition and exercise, but we have to emphasize greater on wellness. So you have to be upfront with the patient that this is not necessarily an overnight fix, especially when we're speaking about lifestyle changes, especially when we're speaking about adults who are busy and have professional lives, personal lives. And so you really want to be upfront with the patient. But a part of that patient engagement and what makes the health professional role, the health coach role so different in this health profession is that, again, it's the patient setting the goals. And so the patient has a say so in their care. And that's one of the things that, and of course, nothing is a utopia. There still are kinks that need to be worked out, but it's something about, I think there's something like patient empowerment that takes place when they're able to set that goal. And it's not just everything the provider says or the health coach says, but it's more about that partnership. And that's how you keep the patient engaged, because they have some feedback, they have some say so about what's going on with their treatment.
Very well put. If someone wants to learn more about health and wellness coaches or work with one in their area, how could they go about doing so?
Good. That's a good question. Again, this is still such a young, if you will, genre of health, if I'm allowed to say that. First, what I would say is check with your insurance, because again, insurance carriers it's just amazing the benefits that insurance have. And, some of us pay so much for insurance as far as the premiums. It's worth checking first with your insurance to actually see if they actually pay for a health coach. Outside of that, I will say check with the National Society of Health Coaches. Again, this is the society that I'm actually certified through, because these are actually licensed professionals. We have to keep up our licensure. So this is not Susie Q on the street who, she wanted to get into health, overnight. No, these are health professionals. And so I would say start there with health coaches who are actually health professionals. They're licensed, and we're required to keep up those licenses because they're standards that are held to. I would say start there.
Sounds great. And we'll have a link for that in the show notes. Well, Danielle, thank you so much for your time. Any parting words for our listeners?
First, thank you again so much, Dr. Leonard, for having me on. One thing that I will say again, I'm speaking from a wellness standpoint, sleep is so vital. I believe that we are learning so much more about sleep. Again, it's one of those younger genres of health. We got what, Dr. Leonard, our first sleep lab around the 1970s. And I just really want to tell people, pay attention to your sleep. We know it impacts your mood. We know it impacts how productive you are during the day. And we're learning more about it. But if we are talking about being a whole, well person, remember your sleep is a pillar of health that is so vital. So along with spiritual health, mental health, physical fitness, financial health, sleep health, relational health, all of these, finding a balance between it all, do not neglect the sleep, because it's so important.
I couldn't disagree more. All right. Well, thank you so very much, Danielle.
Thank you, Dr. Lennon.